healthy lifestyle. So in the long run, we'll be talking about how to manage our health, our eating, and our habits. So next slide, please. So by matter of introduction, so today we're going to be talking about what health is basically. I'm sure if I ask anybody here what health is, you will know one thing or the other about it, and you have one thing to say about it. But I'm going to give us first the WHO standards. It says that according to WHO, that health is defined as a state of complete physical, um, mental, social well-being, and not merely the absence of disease or infirmity. So the holistic concept of health is contained in the expression of what? Wholeness in totality. So health is a relative state in which one is able to function well physically, mentally, socially, and spiritually to express the full range of one unique potentialities within the environment which one lives. Okay, so I'm going to go back to, I'm still on that slide, please. That part of the WHO's definition that says that not merely the absence of disease or what? Infirmity. You know, sometimes if they ask you, how are you? I'm good, I'm fine. Most people, in as much as you don't have headache, you don't have fever, you believe you are fine. You believe you are healthy. And that is why the definition had to really encompass a state of complete, mark that word, complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So would you agree with me that everybody here is healthy? So for it so that you are healthy, first you have to attain a state of complete physical, mental, social well-being. Next slide, please. So that will bring us to discuss the components of these things I've talked about: the physical, the social, and the spiritual, and the mental health. Physical health comprises of everything that has to do with your being, the way you are right now. Everything that has to do with your physical body that can be seen. So if a person has an injury, a person has a cut, maybe you have malaria, you have fever, you maybe you are sick and people can see it or that you can express it. That is one aspect of health. The second aspect has to do with your social well-being. Sorry, I like to move around. This camera people. Your social well-being is very important. We're talking about social well-being. It's actually your ability to relate comfortably, conveniently with people around you. Do you know that if you are keeping grudges, socially you are not healthy? If you are keeping malice, you are not healthy. Mi ò ní kí mọ́. Èmi àti ẹ̀. Hold on. You are sick. If you find it difficult to relate with the person next to you, you are not healthy. See, human beings, we are fashioned in such a way that we can tolerate, you can blend with people around you. And this will bring me to the point of talking about our ego, EGO. Sometimes some people are so engrossed in their ego that it's making it difficult for them to actually communicate, to actually blend well with people around them. They be like, this guy, Joe, look in school now. What does he have? Who is he? If you go and ask about me, I'm the CEO of Nigeria. And so what? And because of that, you see him as a lesser human. Because of that, see, it is that bad that some people cannot sit down where somebody else sat. I don't know if you understand. Some people that have all this OCD, this obsession is called obsessive compulsive disorder. They don't want to see, they can actually, because let's say because that the Oloro they are sat down on this chair, and because in their head they feel, yeah, it's not worth it. If you offer them same chair, they will put handkerchief on top before they sit. Such people would come and visit you in your house. They come with their spoon and their knife. Such people cannot really relate with people around them. You hear, I'm not in their class. Praise God. For you to say that you are socially healthy, it means that you can interact with people and every other social being in your words, in your environment. If you are the type that gets into your office and everybody is going into hiding, you are sick. Ogambo, everybody is hiding. You are parents, you step into the house, all your kids, yeah, everybody take cover. Sorry, daddy is not feeling fine. You're the type that yell on your voice every time. Can you just what? You are not feeling fine. You have to be socially healthy to be able to what? Interact with people around you. You know, funny enough, if you can just flashback, those things that you yell at, you can actually do that without yelling. Especially for parents when handling your kids. Will you go on to your assignment? Will you? And child just be looking at you like this. Mommy, so is mommy okay? Daddy very all right? But you can as well say, oh, come darling, you need to do your assignment, right? When you're done doing it, I'll promise you a candy. Don't worry, if you can do well in your forthcoming exam, I will make sure that for the next Christmas you get a new clothes. Before Uncle, he will have a new clothes, but at least psych the child. You know what your child loves. Promise them those things that you know you can do. Children are very, if you don't fulfill it on your own. Give those promises. Instead of saying, if you fail this exam, I will disown you. What now? So those things you do with yelling, with anger, and see, they're not even parts that some people have this they say with pride, say, I have anger issues. Don't even, I have anger issues. They're proud to say it though. No. I don't agree. And they are proud of it. You're proud in your sickness. That's not nice. For you to be in a state of complete health, you have to be able to manage the social aspects of life. You have to be able to relate with people with courtesy, with respect, with regards. It doesn't take anything from you. Bible even says now that we should be at peace with what? With all men. But some of us, because we are superhuman, we have fought all the people around us. You and this person, Etijari. You and this person, you have shown yourself before to him. This one, I've known who you are. And when they're now coming, Emma, they know that always Araman Koeni. You are just irritable. And mind you, you are always moody, always gloomy. And let me tell you something. By the time you started, I don't know, for people that get hungry, very people that have anger issue, me, I don't have, so I can't relate. But people that have anger issue, when that anger is really in them, their heart rate increases. They force the heart to pump, because at that point, a lot of hormones are being released. Adrenaline is released. And because of that, it tells your brain and your heart a different message. This person is in danger. Please pump more, pump more, pump more. You are overworking your heart. Mind you, the person you are yelling at will be like, nothing has happened to that person. You have done yourself a whole lot of damage inside of you. Consistently. In the morning, you are angry at maybe the kids at home. You got into the bus, you're angry with the bus driver. You You got into the office, you're angry with your cleaner. You get into in the evening as well, you're angry with one client. On your way back home too, over the day, you just have different sections of anger. At different times, you are subjecting your heart to excessive work. And because of that, the heart keep pumping. Over the year, the heart feels, oh, I think it's a way of life for this person. That's to increase the pressure of your blood. Before you know, BP now setting. Now say, no, you can actually maintain that. Let's go to spiritual health. I thank God we are in church. There is this there's this hierarchy of human needs. If you know it, they call it Abraham Maslow hierarchy of needs. We have the lower cadre, the middle, and the upper. And the one down there is the B need. Those ones are the things about breathing, water, things you need for life. At the uppermost part of it, we have what we call transcendent need. Transcendent need means everybody needs to be connected to a spiritual being. Sometimes when some things are really over you, when some things are really beyond your capacity, one of your coping mechanisms is to hand it to God in prayer. It's not as if that problem has gone. No. Let's say they came now and say, fuel is now 100,000 per liter. Your children's school fees now is now 1 million. You know you don't have it. For a typical person that has God, you just run to this altar. Ọlọ́run bó ti wù kó lè tẹ́lẹ̀ orílẹ̀-èdè yìí kò ní lè mọ́ mi. And when you are done saying those prayers, God, I hand over everything to your hand. I cast my burden upon the seas. See, there's a level of relief you feel inside of you. I've committed it to the hand of God. And I believe that it will be done. But if you don't have a connection with God, a typical person would just sit down in their house and start wallowing in pain, in fear of the unknown. Devil, let's say that you are with God or you are with devil. There's no two way about it. You cannot be in between. So if you're not with God, automatically you are with devil. And because devil is so close to such a human being, it will start bringing different thoughts to your mind. Why not go and start kidnapping work? Or why not just go and just do G+ or something? Say, I beg. The worst. Now, maybe you still have a good conscience. You not be like, I can't do this. It's in hard. What if they catch me? You're not saying, kill yourself. Person will start nursing suicidal tendencies, suicidal thoughts. Some people, when they are at home, they think of a lot of things in their mind. They just want to do a lot. But sometimes when they come to church and relate, hey, dance about your sorrow, throw hand up, hear the beats, hear the drums, they feel what? Lighting up. What am I saying here? Our spirituality is very important. So they don't ask us to come and preach here, but it's very important. We are in church. Your spiritual life needs to be given attention. As much as you give your physical health, what? Attention. If you have headache, you will take tablets, right? So if you feel weak in the place of prayer, what do? You go back to God. You reinforce. If you need to meet with the brethren to pray together with you, these things help to keep us sane and healthy. Mental health. Why mental health is even coming last is because all these three things up there, your physical health, social health, spiritual health, if they are not in order, your mental health is gone. It's gone. You can't be mentally stable. And once you are mentally disturbed, you cannot do anything. Because your thoughts controls what? Your action. And that being said, I do encourage people sometimes. Sometimes you just need to help people pamper their ego. Mm-hmm. It's not because you are a fool. Oh. It's not because you are stupid. It's not because you did not know that this person is lying to you. You just want to play the fool. Just want to agree with her so that she will be fine. Oftentimes it's hard to do. I used to have a colleague, she nags a lot. And one day I just tell myself that one day as in I was close to that stage of venting that stuff on me. And I just said, no, I won't do this. And everything she says, I concur. I agree. Why should I be like, everything you're saying here is correct? Apparently, I know I wasn't going to do whatever she's saying. But just because I know she was already out of it already. She has already lost it. And how can I help this colleague of mine? How can this not I'll be like, oh, really? Wow. No. You are right. Yeah. I was explaining to them up there, and they failed to understand. I know that if I should allow her to continue that, and I agree with her, the day is spoiled for all of us in that department. I have to be the one to agree with her. Then she feels so calm, relaxed. Work went on. And as time goes on, I started unveiling it to her. Babe, that's not that you said that time. No, if you work. Then she's back from that state. But and because she felt I'm the only one on her side, I've gained her trust. And she was able to listen to me. And we're able to resolve the whole thing. And she saw the light in what she was really talking. But sometimes it's not about your own mental health. Think about the next person you are relating with. Especially for couple. Spouse should know when their partner is losing it. You should understand his or her weak points. If I know so well, for example, that my husband does not like to eat eba, for example, and because I feel like eating eba, and now I want to make eba on a day when he had a bad day, what am I trying to do? I just want to scatter everything now. Normally, me, I want to eat eba that day. But I know that this guy does not like eba. And maybe really he came from work. He was just telling me, today wasn't really fine. Oh. I didn't really enjoy it. So what happened today? And I'll be like, I bet kill I say, eba ni. He'll be like, are you okay? Because he will have no choice than to transfer all this aggression. He's supposed to come back home to a place of rest, a place of solace. Even if I have made the eba before, I can stylishly say, okay, what do you want to eat? You don't even, no, I actually make it, but I know you don't like it, but let me just let you come back. Do I make some more for you? Or do I just do spaghetti? Even if you're tired, sacrifice at that point. Because this person has already gone through a lot. He's coming from a lot. He should not come and meet a lot in the house. If it's not okay, your own day will start spoiling from that moment. If you're not careful, you carry it to the next day. Your children will come and ask, Mommy, where is my school socks? You'll be like, which socks are you asking me for? Now you have carried it to the children. Those ones too, they will go and say without doing their assignments. The next day they get to school, teacher will start private spanking them. Look at the ripple effect. So sometimes to be mentally stable is not only about taking care of yourself. It's about watching out for others around you. Because in one way or the other, they influence your life. Next slide, please. So let's talk about the health in us continuum. So this scale we are seeing on the screen actually explains the lifestyle choices in determining an overall wellness of human being. This is a scale here of -3 to 0. Then to this side we have the +1 to +3. So at the midpoint of it is the wellness state. And at this side is the sick. Can you also see the -1? The -1 is the sick state. Oftentimes we tend to swing between 0 and -1. Then we will now go to 1. Why do I say so? You woke up at 0, feeling well and okay. After, let's say on a Monday. So on a Monday, you woke up strong and healthy. By the time you face the whole stress of the day, you come back at night feeling what? Sick, exhausted, tired. At that point, you need to intervene. You need to rest. At that point, you need to get back to balance. You now got on that and remember that I need to do one thing and to do that. You know you are sick, you're feeling sick already. You're feeling unwell already. It's a point where you have to come back, find yourself back to that zero. Because if you continue putting that pressure, getting yourself exposed to those stressors, you will move to -2. Illness. And when you are still healed on the bed there, you are putting yourself through mental stress. Even the money to even cure this illness itself is not even there. It is not very easier for you or for the individual, not us, to move towards the angle of death. It's as simple as that. Because it is not easy to come back from -2 back to +1. But it's easier for you to be on a zero, tilt a bit, come back. Tilt here a bit, come back. When you notice the tilt, put in measures. Sleep, rest, eat. So that you don't tilt to 2. Because it may be difficult for you to come back. If you don't have money, if you enter -2, it's easy for you to come out in this economy. Medicine is very expensive. And when you are already on +1, you feel you are okay. All you need to do is to put in efforts. Look for more easier way of doing things, of achieving things. Look for a way to work smart and not work hard so that you can go to +2. And from there, with consistency, you will go towards +3, optimum wellness. So even if you get to optimum wellness and there's a little drop, you are still coming back to wellness, to +2. You're not going back to. This simply tells us that we should pay good attention to our health. When your body is talking to you, pay attention to it. See, there's no trophy they will give to the most stressed human being on earth. I can withstand stress. I can kiniko. One day I was reading my CV. I saw where I wrote that I can work on that. What's the other thing? I just look and say, like, at this point of my life, let me remove this up. At least I don't get one work first. My commodity. Next work I'm looking for, I'll remove this pressure. Before pressure will come and give me. You don't need all those pressure, I beg. That write-up says that health and illness must be defined in terms of individual. Look at that illustration. Health can include conditions previously considered to be illness. For example, a person with epilepsy who has learned to control seizures with medication can now function at home and at work and no longer consider himself or herself ill. Epilepsy has not gone. But the person has learned to control his or herself with the drugs. She's on medication. So if you ask her how is today, oh, I'm good. I'm very good spirits. I'm okay. So what they be wondering, this girl get epilepsy. Oh, she found that she did all right. But at that point in time, what? She's well. She's okay. It's just like having a sickle cell person. If I should have a PCV of 25 now, they will transfuse me blood because it's low for me. But we have sickle cell people that their steady PCV, their optimum PCV is 22. So if we're managing those kind of people, we ask them just, oh, what's the optimum PCV? What's the stable PCV? Some will tell you our stable PCV is 22. So whatever you are doing at that point in time, if you want to push this person past 22, 24, you will cause more harm to him or her. And that is a low state for a regular person. So you can imagine, and they are discharging this patient's home, PCV of 22. You have to know that person's state first. So health and wellness is relative. It's quite what? Relative. Next slide, please. Okay, sorry, this is my slide. It's looking color. I'll go with airport streets. So here I'm talking about the determinants of health. So I have those intertwining cycles, interrelating cycles. So we have the environment, socio-economic status, social and cultural status, and the individual. So I will start with individual. Individual consists of your genetics, your family, your attitude, and religion. Take it this way: things that actually determine what? Your health. I will put family and genetics together. If, for example, a person that was born as a sickle cell child, this person did not choose not to be healthy. The family the person comes from, the gene in the person determines his or her health. Some others that are born with some congenital defects. Some are born with cataracts, with eye disorders. It is the genetics or things they inherit from their parents that actually determine that their level of health. Attitude now is you. You just wake up on your own. I don't eat egg. Normally, I'm not really a protein person. You'll be lacking protein. Your health will be compromised. And in our house, we eat only once a day, and we don't eat some certain food. You will become lean, and you'll be known for that. So it's not as if God made you lean from heaven. It's your attitude that decides that. Some other will just look and I don't really like food. I just like to take Coke. When I take Coke, I'm okay for the day. Somebody will tell you, I don't like eating in the morning. It does not go down well. They will now wait till around 12:30, yeah, around 1 p.m. Then you now, when you now come to hospital, when taking the street, do you have any underlying? Yeah, I'm an ulcer patient. Who gave you? Your attitude took you to that level, and now it has become your identity. Amen. If you are following, say amen. Religion. You are in church. I can talk about this very well here. We have some religious group that forbid some things. Example, I don't know. What me saying one? Pig, right? Okay. Okra. Aloro kinjela. Okay. Snail. All the alore that are here, God will help us in Jesus' name. If you know the vitamin in okra and all these things, you tell me I'm not eating it. God help you. Praise God, you are in church. Because of religion, you have deprived yourself of some things. We know of Jehovah's Witness, they don't take blood. Even if they are dying in bed, they will show you their card. If you dare transfuse them, their lawyers will come for you. So even when that PCV is crashing, you'll be praying, you'll be giving supplements until they come up new. The religion determines that. So these things determines what their health really is. So now I will now move to socio-cultural determinants of health. In all this culture, they will say the man of the house have to eat two meats. Then you will not share meat for the children with your hand. If you came from a loss like me, just wave your hand to Jesus. Nobody, so let me write. Okay, I think it was ignorant then because our parents serve our fathers with 2-3 meats. Even mom say we eat only one. Yes. But for we, the children, like maybe 3 or 4 of us, they will now take a knife and divide it for us. According to our age, the first-born one is bigger than the second-born one. There's the third-born one. Then the last-born, they now give a gungu chicken. Come on from Nopako. You know, they don't just... You know, I ate chicken leg for a long time. I was like, go and buy the last born in this house until God delivered me. See, it's just the family, it's the culture. Oh. The growing child that needs more of this protein do not get it. Then you can't rule Nisha. You can't rule Nisha. In some houses, they'll tell you, it's a culture. Oh. When you are pregnant, you cannot eat snail. Oh. You cannot eat kind of food in our place when you are pregnant. Some they even say that when you give birth, you have to eat bland food. Right? Am I speaking out of mind? Such a cultural belief. A woman that has just gone through birthing process, that has gone through a lot, that have lost a lot of blood, and all they can present after for the next 7 days, onje atelo amaje, plain food without anything inside. What now? These things are such a cultural attitude. And before you know, this woman will not lactate very well. Breast milk will not come. She will not recover well. The uterus will not involve, it will not heal on time. Some other ones, they call about such a cultural belief. I don't want to dive into those women and whatever thing. I'm a midwife, so I will not go to that axis because if I said I will be talking from the angle of where it's paining me. But let's be here. Some of our such a cultural belief. In our place, we don't do this. In our place, even some royal families, like as the first child of the king, whatever, maybe it's some tribe in the eastern part. Then, but it's no longer in practice now. She has to remain slim fit and fine as elegance because she's a princess. So they have to condition whatever she eats, restrict her from doing some things. And because of social cultural belief as well, who can tell a cabinet to come and go to the gym outside? And you know, in those days, thank God for technology. I can only imagine my father in those days, going taking a walk with all of us. How will it happen? It's like disrespect. And daddy, let's go and take exercise. So my father will be running in the front. My mother will be running behind. I want to follow. It's like disrespect. But now you see parents take their kids, kiss them up. Let's go jogging. I'm proud of that. Social cultural belief is that daddy gets home and sit down, chill, read paper, press phone. Hey, you, bring this. Hey, you, bring that. They believe that all this work are not for daddy. So mommy tends to overwork herself round the clock, fend for the children, fend for the daddy, fend for herself. Before you know, mommy breaks down. And those unsensitive people, not because they're not in this church, so not here. They will now tell you, kilo share gono to sunkale gono kilo share kilo ti she. Then she will not have just 3 kids and say, bye. You can't just born 3 and stop like that. What do you mean? My mother had 12. There are 11 girls before me. Before you born me, you have to born plenty. And this woman will have to go through this over and over again. Sorry, I don't want to be biased. Just that is what is happening. She will tell you, I need to do family planning. Then the man will tell you, family planning. And she will need to get pregnant every year. She goes into uterine anatomy. Anatomy becomes so big because the uterus is not even allowed to heal back. You now look at her finish. That's not the topic. Socio-cultural belief, how it determines our health. Let's go to environment. Our environment is very important. Things that we are exposed with, our geographical location. See, if you are living inside this Akibu, like where our church is now, and during that time of kata, if it not catches by the grace of God, because this does, you don't have to go and meet it, it will come and meet you. It's just the way it is. And you see yourself constantly being exposed to kata every time. It's the environment. If a white man should have malaria, he might die. But here, Mosto is like we are colleagues, we are co-citizens of this country. So it is normal for a Nigerian to have malaria. Like, oh, woman, malaria ni jare. But over there, they can't. If you have it, you will just die. They can't withstand it. So the same malaria that you have, Oyindamola has it and die. The environment, and of course, your access to technology. You are supposed to have enough rest. We have a lot of gadgets that can help do a lot of things nowadays. But if you don't have access to these technologies, you will end up overworking yourself. You want to slice kinong porukwe. You want to slice efo, onions. You will date there, buy efo 1,000, cut before you finish. You want to pound the onion, you do. But if you have access to all the technological things, just put them there. The dicer dies it for you. The pounder pounds it, and before you know, you're all good. Socio-economic status is very, very important. It's a huge determinant of your health because it is your pocket that determines what you eat, that determines the kind of health care system you can access. A lot of people have conditions that should take them to the hospital. But because in this country, hospital and healthcare is made for those the rich, they rather remain sick at home. It will not become a norm. Orí yẹn máa ń fọ́ mi lẹ́kànkan. Ó máa wọ́n máa ń lọ ni. If this person has gone to the hospital and seek health care, they will have looked for the cause of that headache and has been gone forever. I used to have ulcer now. It's just there. It's ulcer. It's just the way it is. I've been having it since 14 years ago. Such person might not have access to proper health care, and this thing can be cured. So it determines your health. Because of time, next slide, please. So there are 4 common health challenges in Nigeria. You agree with me? It's common. Malaria, diabetes, high blood pressure, and poor nutrition, amongst others. But this is quite endemic in our locality, and that is why this seminar is tailored towards this. So let's talk about malaria. The next slide. Please give me the mosquito. Next slide, please. Yes. The only thing that causes malaria, let me say it, and believe me for my word today, is this thing you are seeing here. It's mosquito. And I know why I'm reiterating this. Somebody will tell you, Auntie Nurse, I get malaria. How you tell no? The kind of stress what I go through this weekend. I'm wondering, wait, come, let's talk. How did we get here? Man, you not believe me. Last night I was tired. I know if chop like sleep. I don't sleep like that because I was very tired. So I wake up this morning, my head just the bang. Excuse me, why would your head bang? Hypoglycemia. No food, no sugar in the system. The brain is starving. And you come and meet me. And the sweetest thing is that they'll not come and tell you that this is what I'm feeling. No. You just come and beg, which malaria drug can I even take? Who said you have malaria? I know my body very well. Once the malaria is coming. Okay, so malaria is a serious disease actually. It's spread when you are bitten by mosquitoes that are infested by this parasite. So sometimes it can shock you that some mosquito will bite you and you won't get malaria. So it's not every of them. But this guy that's standing here, this Anopheles guy, the female one for that matter, they are the one that mostly incubates the parasite. It's Plasmodium species inside of them. And when they give it to you, it's enter your bloodstream. So it is caused by what? Parasites, not by virus or by type of what? Bacteria. I wish I can underline this thing here. Because somebody will not have malaria and tell you, you gave me only malaria drug, antibiotics in call. Okay, you want to treat this in advance. See, malaria is caused by plasmodium species of the parasite. It is not a virus and it is not a bacteria. If you are sure what you have is just malaria, please treat it. If you have other viral infection, you have bacterial infection, please treat them. Allow malaria rest, please. And the way they say it now is like twin. Akiloshi, money malaria typhoid. And I wonder, where did these two meet? Where did they meet? Malaria is malaria, gotten by what? Mosquito. From mosquito bite. Typhoid comes by you ingesting anything that has salmonella species. So, typhoid, you chop am. Malaria, mosquito, you chop you. Exactly. So, of course, malaria is given by the one that chop you, then you will get typhoid by the one you chop. They are not two, they are not the same thing. They are world apart. And I want to really demystify this thing today. Some of us are very, very good. We are really careful about our health, and I really applaud us. I really applaud us for that. Then we'll go to the lab. We'll do malaria tests. I mean, how the wider test, more? That wider. Now they will tell that you have one in 180, one in 260, one in 300. You're coming down. If you really want to know whether you have typhoid, what you should give them a lab is a stool culture. And that result will not come out that day. It takes like 48 to 72 hours to incubate it. And of course, most times they will even tell you which of these antibiotics these things are sensitive to. Do not go and be eating ciprofloxacin up and down and be packing load on your liver and be like, I've treated malaria typhoid, it's not going. Where will this go? Because you're only treating what you think you have in your head. You're not treating what's inside of your body. If you are here, say amen. So let's all stand up. We need to stretch our leg. We'll sit down for a while. Let us stand up, 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 let us stand up. So now how do we prevent malaria while we are standing? So there's expo on the screen. I will stone somebody in the church. Say take antibiotics. I will stone somebody in church. How do you prevent malaria? Please, we can sit down, please. I just want us to really stretch a bit. First thing, do all in your power to avoid mosquito bites. Because that is the only way you can get it. If you do all in your power to avoid mosquito bites, then you have reduced your very good chance of getting malaria. Then, secondly, you could apply all this mosquito repellent cream. I put Odomos there because that's the commonest one. On the exposed part of your body. I've not really seen anybody that has skin reaction on it, so I think it's safe. And of course, if you feel that you can't do those cream things, please sleep under mosquito-treated nets. Drape mosquito net over your bed. Man for Uruabi. That's why we have other options. If you can avoid that, if you can do that. Some areas, they have like 247, there's AC in the house, so they can use. And of course, put screens on your windows and doors. Some people in this house, maybe some architects will tell you, after we have finished designing this house, now to put nets. It will just disfigure the whole building. Sorry. Rather than malaria disfiguring your pocket and your life, let the nets be there. And of course, you treat all these clothing, mosquito nets and tents with fabrics with insect repellents. Because most of these mosquito nets, they have lifespan. Sometimes they need to be retreated. So, nets is that's in London, that's 1900. It's a lie. It's only nets you're putting in your body. It's not mosquito repellent, so they can retreat it. Otherwise, you can buy a new one, change it. Not until when it's done. And of course, when you are outside, wear long pants, trousers, wear long sleeves to cover your skin. If you know that you're going to stay out late, it's not a time to wear bomb shorts and mini skirts. It's not a time to wear short knicker or to wear sleeveless. Be well covered. Next slide, please. So how is malaria treated? I'll just run through this basically. Malaria is treated basically with medications, and it's either come in form of tablets or in form of what? Injections. Basically, when you have malaria, the first thing to do is to what? Get tested. Once that be confirmed, if it's not a complicated malaria, start with tablets. But I bet you me these days from recent findings, the kind of mosquito that we have in Nigeria, it's like they've gone to Harvard and come back. Because you will use Coartem. You are joking. You will collect 3 days email injection. You are joking. And in short, even in the healthcare system nowadays, what we do, once people will not come to the hospital first, you'll have taken the anti-malaria tablet at home. So if it's resistant, they come to the hospital. That's fine, it's not a problem. When they come, we'll start you with injections. Hmm? When you're done with that injection, you go back to tablets. Just to kill it. Pata, pata. The aim is to kill the malaria parasite. Kill. It's not to silence it. It's to kill it. And of course, most of those drugs come in combination therapy. The artemisinin combination and artemether combination. So we can name them. Now, why am I the one talking? Please give me the name of 2 anti-malaria here. Give me the names, the 2 names of anti-malaria that you know here. Donuts, yes. Okay, Queenie, no problem. I'm a 10 subject. Okay, you come. Attesunate, Amala. Amala, is this in the market? Email, fancy that, all those things, they are all there. But if you have taken the first line of drug and not getting well, please see your doctor. And I have to write this other one big down. Medication can cure you of malaria. It can. It can. Malaria tèmi tí mi ti làgbo kò ní lọ. Next slide, please. Next slide. Medications can cure you of malaria. Get the right treatments. See, the worst that can happen is that they will admit you. We'll give you the IV doses for 2 days or thereabouts. You'll be fine. You'll be fine. So now let's go to diabetes. Diabetes is a common health condition over there. It happens when there is an increased sugar level in your body. So when you hear diabetes, you're hearing sugar, right? Sugar is glucose. So it's fine that we just let us all call it sugar for the sake of knowledge sake and simplicity. So it develops when your pancreas does not make enough insulin or any at all, or when the body is not responding to the effect of the insulin properly. So now let me just do a small anatomy here or explanation. In our body, there is an organ called pancreas. This pancreas secretes an hormone called insulin. Insulin is to help us metabolize sugar in our body. So now, for some people, the pancreas is not producing enough insulin to break down all the sugar they have taken. So what do you expect? There will be excess sugar in the body. Some people, their pancreas has gone on strike. It's not even producing at all. When they have issues like pancreatitis and some other things, some pancreas problem. So sugar will just be flying up in the body. It is not being metabolized. Sometimes, some people are, pancreas is fine, insulin is okay. And this is where our habit comes in. You pump the body with so much sugar that the body can absorb. People that used to do research very well, how many cubes of sugar is inside Coke? 10, Abby. Okay, you know, some people now say, me, I don't drink cocoa. Just take 1 or 2 energy drink, I'm okay. Be calculating the amount of sugar you have taken, though. And some will not, and some will say, okay, I take juice. The juice you take, is it homemade juice, fermented juice, processed juice that's been preserved for how long? So now the technical name for diabetes is diabetes mellitus. So you might be, when you're reading online, you can be seeing diabetes insipidus. For the purpose of this class, we're not going to go into that. We are concerned about diabetes mellitus because that is the endemic one. Insipidus is very, very rare, but they present the same way. If that is diagnosed, just go and meet your healthcare practitioner, they will deal with that. Okay, diabetes can affect people of all ages. And most forms of diabetes are chronic, and it's a lifelong thing. You know, like last week, one diabetes a week, you did long, but you follow. Miracle, not the tire Jesus. But yeah, that's miracle. But when you are managing diabetes, it's usually a lifelong thing. And of course, all forms of diabetes can be what? Managed. Medications and lifestyle. Next slide, please. So now, briefly, I will run us through the types, just sharp, so that I don't want to bug our head with academic work a lot. Okay, so type of, we have firstly we have the type 2 diabetes, the one that is common, most common type. And with this type, your body doesn't make enough insulin, or your body cells don't respond normally to the insulin being produced. So this is the most common of diabetes, and it mainly affects adults, but can be seen in few children actually. So this is the one that your body, it's either that your body stops producing enough insulin to actually metabolize the glucose you have in your body. In pre-diabetes, it's actually a stage before the type 2 diabetes. In this case, your blood glucose level are higher than normal, but it's not enough to be officially diagnosed as type 2 diabetes. Some people can bear witness to this when we do those our health check. Your blood sugar can be a bit normal, can be a bit higher at that point in time. Doesn't mean that we're giving you a verdict, bagam, you're not diabetes, no. It might be that a particular thing you have consumed at that time might actually trigger it. You understand? But it's better that whatever you eat, your body should be able to absorb it. But if it does not happen, it means that you already fall into the pre-diabetes stage. You should now watch out, so you don't land in the full-blown diabetes stage. So we have the type 1. The type 1 is mostly an autoimmune. When something is autoimmune, it is inherent. It is just, it is your immune system, your body, that is just reacting in such a way. So in this type now, sometimes the system attack and destroy insulin producing cells. Most times, these causes are often unknown. So it's actually the type 1. Most time it's common in children. Most time they will have it start seen as kids, although some start getting it later in life. But of course, it can manage as well. And of course, we have the one we call gestational diabetes. You see, women, God will help us in Jesus' name. A woman that's been living her life normally with nothing happening to her, all because she wants to bring forth a life, she becomes diabetic. It happens. It's not our fault. It's just at that point in time, a lot is going on in our system that our body cannot really contain. And most of the people that have this, for us to be sure that it is pregnancy that is causing it, before pregnancy, they don't have it. And after childbirth, most after about 6 weeks, their sugar level returns back to normal. So oftentimes, it is caused by that pregnancy was status. And however, any woman that has had diabetes while pregnant has tendency of now having type 2 diabetes in later life. So such person should take precautions. You should know that it is not business as usual. Start taking precautions not to really come down with it later in life. Next slide, please. So these are the readings. So I do encourage people to do their testing often time, or when you go for a seminar or for a health program. If you want to do fasting blood sugar, it's called fasting. It's not starving, no. It's not starving blood sugar. It is fasting blood sugar. Your fasting blood sugar should be between 8 to 10 hours. By the time you are going to 12 hours plus, it's starving blood sugar you will get. And in that case, because then your body has started breaking down fat cells, So to give us a wrong result. So because you want to do fasting blood sugar, you want to eat dinner before sleeping. So that you will fast while you are asleep and do your test in the morning. Not you not taking dinner. Then that means from lunch you have been fasting till dinner, then till the next day that is starving. You can give a false positive or false negative result. And of course, this range is in milligram per dl. If your machine or your glucometer tests in millimole per liter, anything you get in this figure, just divide by 18. So don't be confused. And my own give me 4.8, or the one they wrote for me in the hospital is 4.2. But this one you are seeing here, you said the number one is 70 to 100. Don't worry. Divide this, just multiply that by 4.2 times 18. You will get this range. Is it clear? You know clear? Okay. All right. And of course, this other last one, if you do a random blood sugar test, is those other one that is taken after at any time. We don't mind whether you have eaten or not. We expect that your body should have metabolized the food that you eat. And of course, random blood sugar is best taken as maybe 2 hours post eating, so that the body will have got to the peak of metabolism, and you can check. This one we call HbA1c. It's actually a blood sugar a sugar test that is done to check the level of sugar in your body over the past 2 to 3 months. So if you do this test, it will give us a picture of what your sugar level, an average of what it has been for the past 2 to 3 months. So next slide, please. So what are the symptoms of diabetes? It's very good that you know the symptoms so that you can watch out for it. Increased thirst. Just be drinking water anyhow. Don't mistake it for this weather. Because in this weather, if you are not careful, you will drink a drum of water. But there is a significant increase in thirst than usual. If you have a wound, you have a cut that is not healing on time, please go and check for diabetes. It's not everything that's called a guadage, you know. You know that you have a wound and you have been dressing it, or even as small as knife cuts, and the thing refuses to go. Please check for diabetes. That's one of the symptoms. Fatigue, you get tired so easily. Find yourself just sweating. You don't have energy to do anything. This is not about laziness, so it's about you just getting tired. Any small little thing, you are tired. Check your sugar level. Blood vision. Isn't you like this? You are seeing like, this air you make, is it 2 shuku? Oh, sorry, it's 1 shuku. I was thinking it's 2 shuku you are carrying. Please, check very well. Frequent urination. You can't hold urine. You just need to go and void. And you're not pregnant. So you're a woman. And as a man, you don't have any problem with your prostate. Please check diabetes. Unexplained weight loss. Just losing weight. And apparently you cannot say you're not fasting. You're not starving. You're not exercising. You're not doing fit farm. You just lost weight unnecessarily. Please check. Check your diabetic status. Next slide, please. So how do we manage diabetes? So there are four main mode of managing diabetes. So we'll start with blood sugar monitoring. Because for you to really manage it first, you have to know that you have it. And you have to know the level so they can communicate to your healthcare practitioner and they can know how well to really intervene. So blood sugar monitoring is the key. It helps to determine how well your current treatment plan is going to work. And of course, it can be done daily. It can be done as prescribed by your practitioners. Because sometimes we do what we call 6-point glucose check. That one, you will do a fasting blood sugar. You will not go and eat. 2 hours after eating, you do another one. That's number 2, right? For lunch, before lunch, you will do. 2 hours after lunch, you will do. Before dinner, you will do. 2 hours after dinner, you do. That will give us a picture of how your body is metabolizing food with the kind of food that you take. So there are so many patterns of you doing the blood sugar. Also, we have diet, meal planning. Some people, when they are being diagnosed diabetes at the early stage, they might not really need to go on drugs. It could just be lifestyle adjustments and diet replanning that will really help them. So next slide, please. And of course, for people that now have been confirmed, maybe the dieting is not helping it. So of course, they might have to be on insulin. That one that the body is not producing well or not enough. We might need to give them through what? Injectables. And also, some can be on medication. The common drug is what? Metformin. A lot of people are on it, and it's working perfectly well. And of course, exercise, physical activities. It increases insulin sensitivity, and it helps to reduce key and insulin resistance. So regular exercise is important to really help you manage all of this, because by the time you have this glucose stocked in your system, plenty sugar, and you did not burn it, it overflowed your system, and sugar level becomes so high. But by the time you burn it in a place of exercise, the body absorbs it, and of course, insulin works on the rest, and you are good to go. Next slide, please. So what are the complications of diabetes? Let's start with stroke. When the person has diabetes, the blood becomes very thickened. By the time the blood becomes quite thickened than usual, it's easy to clot. By the time it clots, this tiny clots travels through the blood vessels. They can find themselves into the brain, because blood circulates our body all around. If it gets into one of the tiniest vessels in the brain and obstructs it, that part of the brain stops working. That place does not get blood supply again. Then strokes comes in. Because the part of the brain the part of the body that part of the brain controls is not getting enough blood. The function stops. Then you can have paralysis. Diabetes is bad. Heart attack. This same clotted blood runs into the heart. And because this blood now is now very thick, it becomes viscous, as in become thick. So it needs more pressure to pass through what? The blood vessels. What do you expect? Increased blood pressure. That is why diabetes and blood pressure, they are like sister and brother. So if you're diabetic and you don't have high blood pressure, please manage this very well so you don't have that. And of course, peripheral artery disease. Those clotted blood can find their ways into the artery and it becomes shake boing cocaine, feel it. A lot of people have that symptom. Some will even step on nail they did not know. Yes, it's that bad. They call it diabetic neuropathy. That part of the nerve is dead. And of course, vision, retinopathy. Your retina is in your eye. It can obstruct your vision. It can give cataract, that whitish blurring of the eyes, eyeball that you will see. And I swear go as far as giving glaucoma, diabetic foot. Those people that say they have diabetic neuropathy, they will step on nail they don't know. They have wounds on the leg that does not heal. And because blood supply to the uppermost of the body is more than the leg, that healing is more reduced. And of course, kidney begin to answer for it, because every blood in your body goes to the kidney. The kidney does the filtration. Now you have given the kidney an excess work to do. The kidney gets overworked. The kidney has the consistency of blood it can work on, but now the kidney cannot longer tolerate it. It begins to pack up. And of course, peripheral neuropathy, nerves are beginning to die. Next slide, please. Of course, blood pressure is what everybody knows, so I will not really dwell more on that. We all know that our blood pressure has to be well monitored. When they tell you your systolic is the upper one, the lower region is what? Diastolic. Next slide, let's see the table. So this table is what shows what your normal BP should be. So if your BP, no, I said systolic is the one up, right? And the one down is diastolic. So whenever they give you a BP result, they will always write one up, one down. is always over something. So if the one up is less than 120 and the one down is less than 80, it's fine. So now, for the sake of emphasis, so that when you have low blood pressure, you would know. That one up there, should be between a 90 to 120. If it's less than 90, let's start looking into it. And the less down one, right, should not be less than 50. So 50 to 80 is safe. Now you're beginning to get 128, 125, to over the lower one too. You're getting, maybe you might actually be getting less than 80. Or you can actually get above 80. But the fact that your stomach is elevated, you need to really look into it. Now, for elevated BP, we will not really bother. It could be stress. You could just be coming in right now. Check my BP for me. So it's activity. It can give you that elevated one. So when you go back and rest very well, and you wake up and check it again, it will come back to normal if you don't have high blood pressure. But whenever you are having between 130 to 139 upper limit, lower limit 80 to 89, you are beginning to have a high blood pressure, but at stage 1, it's still manageable. So according to the US regimen, from 130 upward, they will diagnose this hypertension. That's why this image was coined from American Heart Association. But in Nigeria, we wait till they reach 140. It's until when you have 140 over 90 or higher, we'll tell you have blood pressure. So don't be shocked if you go anywhere and say you have 130 over 80 something and they say it's high. It's still, you are tending towards the higher zone. But once now make it to hit 140 over 90 upward is high. And of course, if you now go to hospital, they now check your blood pressure. It's about 190 over 120. Or 200 over 1 kinikon is an hypertensive crisis emergency. Please find your way to the hospital. Don't say, you can look making soon. Yeah. Should be in the hospital. Next slide, please. Okay. So this one is just showing you the image of what the blood vessel looks like and how blood flows in the vessel and exact pressure on those walls. So it is that pressure that we are measuring that gives us that lower and the higher one. Next slide, please. So what are the factors, the risk factors for having high blood pressure? Mental stress. I've explained that earlier, right? It can actually make your body secrete some hormones that will make your heart start beating fast, and before you know, your pressure start increasing. The next one is excessive body weight. In these days, you don't have anything to gain being a robot. You don't need it because you have a lot of fat that can get into your blood vessels and give you fatty cells. And before you know, the blood vessels will start narrowing. And once the vessels are narrowed, the blood needs more pressure to flow through. IBP has entered. Excessive sodium intake. Excessive salt intake. The family of slots. Some of us, we eat like this. We have table salt. We still sprinkle yours. What here? After they are finished, you don't need this place. Because sodium traps water in your body. And once it traps water, I don't want to use extracellular cells. Too much water in your body, right? It compresses those blood vessels. You understand? So for blood to flow through, pressure. I hope you understand that. And also, inadequate exercise, you need to really charge up. Excessive drinking. Let me even remove excessive there. Drinking. So you don't have business with alcohol. You got no business with it. I won't preach that over and over again. Please, if you are addictive to it, seek help. You can actually be helped out of it. Smoking, no. Check the rules in that park. Smokers are liable to die young. Okay. So those are the risk factors. And of course, being over age 55. In Nigeria, being over age 40. Safe. You are at risk of having it. If you have family history, momsy has or popsy has, there's tendency that because your lifestyle pattern is almost the same thing. So you might end up like them. So there is a good reason for you to start doing lifestyle modification. And of course, they said being blacks is God that will help us. So. That just because our race is black, that there's some genetic things in our system that actually predispose us to having high blood pressure. God help us. If you have some other diseases like kidney diseases, metabolic problems, you can start having that. So, of course, next slide. So, we like this guy, right? So, you might be wonder if you can lower your BP naturally. Yes, in some cases it's possible without medication. For example, if you have IBP stage 1, that 130 to 139 thing that I mentioned earlier on, if you can modify your lifestyle, start eating healthy, exercising, you keep a healthy weight, before you know, you'll be fine. It's something we call DASH diet. That is dietary approach to solve hypertension. It really works. So keep a good weight. This guy explains it all. Next slide. Of course, cut down on salt. I will have to say that. Our people in Yoruba land. Potassium, everything, common must go inside. But say, well, common must be there. Say, you must commonalize it. Reduce that. Do exercise. Yeah. So the idea of exercise it's not until when you enter gym. You can be in your house and do any of these ones. Just run around your compound 3 times. You'll be fine. All right, next. So the last part of this presentation is poor nutrition. Because everybody is shouting, sakpa everywhere. There's no food. Now, the people now eat by luck once a day. So our body needs a lot of nutrients to work. But sometimes when our intake does not match the level of nutrients our body deserves, there is poor nutrition. Some people are not watching their weight. It's lack of nutrition. And it's more evident in kids, children. Those ones, their body cannot lie. If you don't give them food, you will see it. Just give them 2 or 3 days, they will lose weight. And when you don't eat the right food you need to eat, your mental capability is decreased. So all this will say, I don't eat breakfast. I beg in the name of God. If it's a cup of tea, please take it in the morning that contain glucose. Don't starve your brain cells. Because most time, the morning time is actually the time that you need to think, you need to work. It's your most active time of the day. And you're working on reserve. Doesn't really make sense, right? So even if you cannot eat a bulk of food in the morning, please take tea and bread, something that has a little of protein here, a little of carbohydrates here, to actually boost that reserve that you have. And I did say that when you want to eat, in the morning you eat like a king. In the afternoon you eat like a prince. At night, eat like a pauper. Like a slave. Láàárọ̀ tẹ́ bá fẹ́ jẹun, oúnjẹ yín kó rich bí oúnjẹ ọba. As if you want to serve a king, you have everything available. That's breakfast. If you want to take lunch, eat like a prince. Of course, the prince's food cannot be as much as the king own, but it's everything that needs to be there is there. You see, at night, eat like a slave in the whole place, because you're not going anywhere in the midnight except for those that do night work. Just a little you need, and you're going to bed because you will not burn it. Next slide, please. So, of course, the commonest thing is undernutrition, but we have overnutrition. Mother will tell you, I can finish bread 1.5. They won't be boasting. Bread you go to me, Jay. Some people tell you, I can finish 1 mudu of rice. Don't dare me. The mudu is big, the reka is small. The reka I want to say. The reka for those that's in Lagos and Southwest. It is not about how far, it is what? How well. And if you are eating, you should eat that your body can be able to absorb it. So let's go to the next slide. So here's our food pyramid. This is basically what your food should contain. In a day, you should have fruits. No matter how little it is, you should have fruits in your food. People that like bread, say you have seen your bread. Don't worry, eat bread. It's allowed. That bread there actually depicts other complex carbohydrates. But shall you see how we arrange it up, right? These ones that are the base, eh? You eat plenty of them. Followed by the vegetable group. I don't know if it's quite explanatory, right? You follow by the complex carbohydrates. You see where your bread fall, right? Your bread is not in the number one. No. It's not in number two, it's in number three. So your bread should not be bigger than your fish. Okay. Then we have fruit and berries at the end of it. So the next slide, please. Next slide. Yeah. So look at your plate. See what your plate should look like. Media, you even must eat this kind of plate today if you have light. So if you are really trying to lose weight, this plate works very well for you. And if you're trying to really maintain your body weight, look at the veggies. Look at the protein. Look at where your gari is, your eba, your semo, your rice. Sure, you see their portion in this plate. That's how you should divide your plate. Next slide, please. So I have to relate it to our African food. So if you want to eat food, if you want to eat rice and plantain and chicken, right? This looks like what we eat almost every day. So the rice should not, some people, the rice is too much that the plantain will not see where to stand. So they have to create a plate for the plantain separately and another plate. See, the Oyinbo we are copying, you know what they used to do? When you put us on the table, they will carry one plate, right? And serve everything inside that plate in the portion they will take. Not that they will finish this one first, enter that one. So if you want to eat, that red one down is porridge. You see your porridge there? Just there. Maybe your yam porridge, potato porridge. See the meat and see the plantain by the side. And your stew too, if you can try. Let your stew, don't let everybody just be stew like that. If you can have some leaf in your stew, it will make more sense. Once you eat rice, see where your rice is stopping down. That white rice, also that you go and buy rice of, if my rice 300, and 20 naira. Me need there. Don't do that. You need it. You need it. God help us in Jesus' name. I think I'm done with my presentation, right? I think I'm done. Yes.